common challenges seen in pregnancy and post-delivery these days?
Nowadays, I find that women are planning their babies much later than earlier, and so many women are above 35, which we consider a high risk pregnancy, and a lot of PCOD patients are there. PCOD pregnancy is again a high risk pregnancy, even though if the age of the mother may be less, but the hormonal imbalance is there, and to carry the first 3 months are very crucial because the hormonal imbalance disrupts the pregnancy, and we have to give hormones in the first 3 months of the pregnancy for it to carry through smoothly. After that, the pregnancy can be normal in PCOD patients. Obesity is on the rise. Again, obesity has its own challenges because anyway in pregnancy you are going to gain 10 kg weight, and if you are already obese, then it becomes there are more chances of premature babies, intrauterine growth retarded babies, and hormonal imbalances in obese women also. Thyroid disorders are on the rise. We don't know why more women are being diagnosed with thyroid disorders. Maybe that people are getting tested more often, and also I think it is the chemicals in our food and the air which is causing more of endocrine problems. So thyroid doesn't really pose much of a problem during pregnancy if it is properly corrected. If the thyroid levels are normal, then the pregnancy will have no problem. But if there are anti-thyroid antibodies, then if the thyroid levels can fluctuate during pregnancy, that can give us a lot of problems. Blood pressure, sugar, all these things are also we are seeing more often, especially diabetes, gestational diabetes with pregnancy, because if the diet is not good, if the mother gains too much weight, then there are more chances of getting gestational diabetes. PCOD patients are more likely to get gestational diabetes, and of course if there is family history, then again they can develop gestational diabetes, which is also a complicated pregnancy. Hypertension during pregnancy can happen to anemic mothers, protein deficient mothers, and of course family history of hypertension that can contribute to hypertension during pregnancy, and that can lead to a growth retarded baby also, and premature deliveries can happen because of that. So
How can a pregnant woman take care of herself?
normal advice is that first thing is that we have to start the folic acid and B12 3 months before conception, because if you are deficient in folic acid and B12, then there are chances of neural tube defects, brain defects in the baby. There are so that is very important to take the supplement beforehand, and regular exercise is very important. Walking, cycling, swimming, they are all allowed during pregnancy. That can help. A nutritious diet is very important. The diet should be high protein and lots of fruits and vegetables, lots of milk and milk products, which are a good source of calcium. And for iron, we can take non-veg and palak, gur, all that. So the iron and calcium levels have to be supplements have to be taken during pregnancy. Regular checkups is very important. In the till 28 weeks, the checkup has to be every month. After that, it has to be every 15 days, and after 36 weeks, it's weekly checkups. So that is very important, because early detections of any problem can be managed easily. If we miss things, then it becomes difficult to handle later on.
How can a new mom take care of herself?
New mom, first thing is early ambulation. She should be up and about as much as possible, as fast as possible, because that will give her the confidence, that will give her a emotional well-being feeling, that will help in her, she won't get urinary infections, and she won't get constipation if she is ambulatory, and so that is very important. Then of course nowadays mothers are very particular about going back into shape, so postnatal exercise is important, which can be which should be done. And of course breastfeeding is a very is the gold standard of for the baby. Breastfeeding is the best nutrition for the baby.
Any special tips for pregnant and new moms with COVID cases rising again?
See, if you have the risk factors, like your age is more than 35 years, or if your BMI is more than 25, or if you have some comorbid conditions like diabetes, blood pressure, then you are likely to get a more severe COVID during pregnancy. As it is, the COVID can be more severe during pregnancy, but we are seeing more ICU admissions in COVID during pregnancy. But that is not always because the mother is having some severe COVID infection. Sometimes it is just that we want to take better care, we want to be more vigilant, we want to do more observation, close observation of deterioration, so that prompt action can be taken. So that's why they are getting admitted in ICUs. Though according to a UK study, the death rate is not higher in mothers who have COVID. The UK they have reported a death rate of 2.2 in 100,000 mothers, so which is not high. So so for COVID you have to take the normal precautions which all of us are taking: social distancing, wearing masks, not to go out of the house much, not to allow people from outside to come into your house, not to meet them, and if you have fever, cough, cold, then talk to your gynecologist, do your COVID RT-PCR, and if it is positive, you definitely have to consult a COVID specialist also.
So now anything that you would like to say about Rosewalk being a COVID-free sector and how it's safe for women to come and deliver here?
Yes, definitely. That's a very big advantage. Definitely right now, because COVID cases are rising so much, it is so reassuring. Like my patient, she lives in civil lines, but still she prefers to come here for her drip because this is a COVID-free hospital. She feels safe in coming here, getting her drip, and going back all the way to her house. So that is a very good feeling that it is COVID, and during pregnancy, during delivery, to have a COVID-free hospital is a very rare thing nowadays. All the hospitals are having COVID patients. So definitely it's a very big thing.
Hi, I'm Riddhi, and I've been Dr. Sunita's patient at Rosewalk since the past 2 years now. My journey during pregnancy has been full of ups and downs. Getting pregnant during the middle of a pandemic has been very stressful, very scary. At the same time, it's my first pregnancy, so I've thoroughly enjoyed getting pampered with my husband, and it's been quite exciting. About becoming a mom, I feel I am really scared taking on this huge responsibility. At the same time, me and my husband are looking forward entering into a new phase of our lives, and we just wish for the baby to be healthy and to be happy. Few things I would like to say about Dr. Sunita, that she's been there 2 years of my life, treating my PCOD, being there odd hours of the day, of the night, being my listening ear, and she's been very thorough with all my treatment. I just feel I've been super lucky, and I love you, and I'm so lucky to have you in my life.